All right, there you go, Snell.
All right, so in the Trauma Recovery Center at Metro Health, we have a team of individuals that go from the lead trauma recovery coach to a ED, which is Emergency Department Trauma Recovery Coach, who specifically works on the weekends when individuals enter into the ED and they are identified as a victim of a crime. And that can include a violent crime such as gunshot wounds, stab wounds, sexual assaults, and also domestic violence. In our center, we have also trauma recovery coaches that see our inpatients, such as Marlon Leak here, Tony Zangali, and also Sarah Kowalczyk. Katura is our community health worker, and what she does is work with individuals specifically in the community who report to themselves or through a questionnaire, which we call the Social Drivers of Health questionnaire, that they are in need of services within the community. So what Katura does is specifically works with these patients and assist them with getting connected with identified services that they may need. Yvette is our clinical counselor for our violent intervention prevention program through the Metropolitan Courts here in Cleveland, Ohio. We do have a couple of vacancies, which we just filled, and we recently hired a peer coordinator. And what our peer coordinator does is we have a specific program of individuals who have experienced a traumatic event or experience, and they come back into the hospital, volunteer their time to provide emotional support with individuals at bedside. Circling back to our coaches who provide inpatient services for our patients, they meet with patients and families also at bedside and provide them with emotional support and resources, inpatient and also outpatient. I have with me today Shawnice Taylor, who is our SANE nurse, and she works in the emergency department. She typically sees individuals who come through the emergency room and they are identified as a sexual assault. I will allow Shawnice to talk a little bit about what that looks like for a patient who enters into the emergency department after they identify they have been a victim or survivor of sexual assault. Shall we switch?
Yes.
Hi, my name is Shawnice. I'm a SANE nurse, but we're also called forensic nurses at Metro Health. And when a patient comes in as a sexual assault, once they get medically cleared meaning the doctors have seen them and cleared them of all their trauma, such as if they were strangled, they get scans to make sure they don't have any internal injuries. And once they're medically cleared, I go see the patient, I introduce myself to the patient, build a rapport with the patient. And once the rapport has been established, I ask the patient, give me a little information on why they're there. And then after that, I ask them do they want a sexual assault exam. And once they consent to an exam, I let them know what the exam entails, which will consist of swabs of multiple areas of the body. And once that's over, I connect them. I ask them, do they want to be connected to Trauma Recovery Center? And once they give permission to or consent to connect to the Trauma Recovery Center, I'll send an in-basket or I'll email to let them know to follow up with the patient. That consists of my exam.
Thank you. Thank you.
Yes. So my next slide here is what I am presenting to you today, which is trauma-informed care. Trauma-informed care consists of 5 categories, which you can see here on the screen: safety, trustworthiness and transparency, collaboration and mutual empowerment, voice and choice, culture, and historical. So first, when we talk about safety, safety can include shelter, a trusted individual, or a plan for next steps. Safety is first because if an individual does not feel safe after experiencing a traumatic event, then none of the other categories will actually matter. These individuals need to know that they feel safe, and as Shanice mentioned, it's important to establish that rapport quickly and make sure that that they understand that you are a safe person. And we also need to keep in mind when dealing with individuals who have experienced a traumatic event or situation that they don't really trust. And they don't trust because the individual that may have hurt them, that they trusted them at some point. Trustworthiness and transparency allow the individual to be the expert of their story and experience, even if we have seen the same situation or event prior. Each experience is different. So for example, just because you have a patient that come in, and it could be the same patient, and I'm gonna speak in terms of patient, just because of that, the culture in which I work at a healthcare facility. So even if you have a patient who has come through the emergency room before and they have received the same exam before, as the healthcare professional, it is important for us not to be judgmental, like, well, like, why do you keep putting yourself in these situations? That does not really help a person. So it's important to establish that trust with that person. And you can do that in multiple ways. One, by listening to the individual and taking note and assisting them with the resources and services that they identify that they need. And that goes back to allowing the individual to be the expert of their own experience and their own story. Oftentimes as professionals, we can, have this grand plan or ideas of what this person or individual could benefit from, but it's not necessarily what that individual wants or need at that time. Collaboration and mutuality, work with the individual as they are the expert of their journey. Again, you may see that a lot because again, as professionals or seeing this event or situation before, we may think, okay, I did this for the last person. I know that worked for them. Let's see if that'll work for this individual. And we can't go into situations with a cookie cutter approach because not what worked for the last person may not work for the individual that is presented before you. As the professionals, we should assist with guiding. So allow the person to tell you what they need. Do you want shelter? Do you need a safe place to sleep? Do you want to relocate? What are you in need with? Do you need transportation? Do you need me to call a support, someone who's in your support system? What is it that you need from us? That also established that trustworthiness, especially if an individual is telling you what they need and you are able to fulfill that need for them. It shows them that you can be trusted, that you can follow through on your word, and that you are caring and want to see them healthy. You want to see them safe and give them resources to make them better or help them to become better. Allow the client, patient, individual to make the ultimate decision. Again, offer the services that you have and that you can offer. So we don't want to make promises or tell a patient or a client individual that this is what I can do for you, and we don't have that service or we can't make that possible for that person. That creates a lack of trust. And you want it to be mutual, again, that mutual piece, if that's something that, they say, I don't want to go to a safe shelter. I don't want to go to a safe place. I want to return to this individual who may have assaulted me, who may have abused me. And we may think like, why would you want to do that? Again, not being judgmental and allowing the individual to make that choice, but support them with that. So then that's when you could create a safety plan with this person. Okay, so if you are going back to this environment, How can we keep you safe? Do you have a phone? Do you have a way of contacting someone who can get to you or support you? Do you have a way of contacting law enforcement or someone who can get to you quickly that could provide you with care? Empowerment, voice, and choice. This is really important. Oftentimes when we're working with individuals who have been in it, a victim or survivor of sex trafficking, domestic violence, or a sexual assault, they feel like their voice has been taken from them because when they said no, or I do not want to, they were forced to do something that they did not want to do. So that voice and choice piece, and also empowerment, can't leave that out. That is very, very important. All of these steps honestly tie together and they're all important, but this empowerment, voice, and choice. We empower individuals by giving them choices to use their voice to make the best decision for themselves. And we want to empower individuals to make the best choice for themselves because we may not always be there. So we want to give them tools that they have in their tool bag, which is the decisions, choices, to use that. We want to empower them to use their voice. So if we are giving them the safety plan and something transpires in the environment in which they return, we want them to use that plan because we may not be there in the early morning or the late nights where they can call us and we run to their aid and be there for them. So we want them to use those tools that we give them, such as a safety plan.
You have a question?
Okay, go ahead with the question.
You can wait till the end.
Okay.
Yeah.
We may advocate. We may advocate.
Need to mute yourself. Okay, go ahead. They should be muted. Sorry, go ahead.
We may advocate on behalf of the individual, and when we advocate, we are simply be a voice for the individual. We should honestly make, when we advocate, that can go back to that collaboration piece. So we may be working with the individual who say, I want to go to a shelter, but I went to a shelter before and it was not a good experience. Here in Ohio, I have worked with individuals who have went through not so great situations at shelters. So as an advocate for them, I speak with the staff and say, hey, I'm working with this individual. I am advocating that, they have extra support or additional support that may or may not be available for them at that time in that setting. So I do, keep in contact with them, not just letting them go on their own, but that empowerment piece. So for example, if I'm working with the individual and they are at a shelter and they don't feel comfortable, they try to speak with staff and voice their concerns, and they do not feel like the staff heard them, or they did not feel like what they said mattered. If I am following up with this individual, which follow-up is very important. Follow-up is very important. I can call this place and say, hey, I'm working with this individual. They mentioned to me that they have concerns about X, Y, and Z. Is it possible that someone can look into this? So that's that advocating part. But we want to empower these individuals to use their own voice and then advocating for them as a support. Cultural and historical, it is extremely important that we consider the history of the client or individual that we're working with, and also the culture. Culture is very important to who the person is, who the individual is, and we can't discard an individual's culture or their history because we feel like, oh, you're in a new environment now, and this is how we do things here. Not all the time we can make those accommodations, but it is important to hear that individual and what their history and what their culture is, because we do not want to re-traumatize an individual or create new traumas for an individual in an environment in which we are attempting to assist this person with healing.
Next slide.
Yes, please. So how Metro helps in the community with and our essential role with trauma-informed care and also working with individuals who are in need of services. So our essential role of mental health in the community is dedicated to hope, health, and humanity. So we have been serving in the Greater Cleveland region since 1837, way before my time. So we have a reputation in the community because we are a public entity hospital where we accept all insurances, whether you have insurance or not. We don't turn anyone away. We provide you with care. We are also we're the first level 1 trauma hospital here in the Greater Cleveland area as well. And so we redefine healthcare by going beyond medical treatment to improve, can't see the last word. I believe it's a foundational communication, community health and well-being, affordable housing, a cleaner environment, economic opportunity and access to fresh food, convenient transportation, legal help, and other services. So we have a multiple services that we offer at Metro Health. And I should even go back a little bit and talk about the history of the Trauma Recovery Center, because we are the only trauma recovery center in Northeast Ohio that's located in a level 1 trauma center. There are 8 other trauma recovery centers here in the state of Ohio, but at Metro Health, we are the only healthcare facility in Northeast Ohio who has a trauma recovery center in-house. We also do community events as well by going out into the community, which I'll get into in my next slide. Talk a little bit about that, but we operate Ohio's top rehabilitation center, the region's most experienced level 1 trauma center, and Ohio's only adult and pediatric trauma and burn center. So if an individual, when we have had individuals that have been assaulted by chemicals and also fire, which resulted in a multiple degree of burns to their bodies. And so we have a burn center in-house as well, where our trauma recovery coaches will go to the unit and meet with individuals and those patients and their families at bedside as well. You may be thinking like the background of the workers that we have with trauma recovery coaches. So they have a social work background. Majority of the social workers are licensed social workers. And there is a difference between the trauma recovery coach, the nurses, and the social workers that work within the hospital system. So the social workers, they're primarily focused on insurance, safety planning, and discharge planning and getting this individual to their next level of recovery. The nurses in the hospital and this healthcare system, they more so are attentive to the wounds, the medications, and things of that nature, and communicating with the other providers working with the patient. The trauma recovery coaches, we have a specific and unique position within the system where we are able to meet with these patients at bedside, assess their need, and attend to their emotional wounds as the other providers attend to their physical wounds, which is also important. Safety, we are a safety net hospital for Cuyahoga County, open and accessible care to all, regardless of ability to pay. 2/3 of the 300,000 plus patients are either uninsured or covered by Medicaid or Medicare. Care providers at 4 hospitals for emergency departments and more than 20 health and 40 additional sites in Cuyahoga County. So we do have multiple satellite sites ranging from the east side of Cleveland, Ohio to the west side. And there also are some locations on the south side of Ohio. Next slide. Yeah, put it in.
There you go.
All right, so The overarching department in which we are a part of is called the Institute for Hope, which stands for Health, Opportunity, Partnership, and Empowerment. Got that right. I'm so proud. Oh, there we go, right there. In 2019, Metro Health launched the Institute for Hope, which uses a coordinated collaboration and strategic approach to help patients with non-medical needs. So again, as we talk about the Trauma Recovery Center, not only do we meet with individuals inpatient, but we also meet in the community to assess the needs of the community and provide them with resources and the emotional support that they may need. 80% of a person's health depend on factors beyond medical care, including safe, stable housing, health, nutrition foods, reliable transportation, education and training, job opportunities, factors known as social determinants of health. And how we assess the social determinants of health, which now we call drivers, is through a questionnaire, and it lists a list of services, even ranging from their safety, starting with their safety, if they are in need of food, if they're worried about running out of food, or if they have ran out of food within, this is over a 12-month period, if they feel safe in their home, if their home is in need of improvements, if they have transportation, if they're able to pay for basic needs such as healthcare, food, and transportation needs, and they also assess a number of other things as well. And once an individual identified that one of the 4 intimate partner violence questions, whether they feel safe at home, it is routed to our department. We, at the Trauma Recovery Center, we reach out to these individuals and we assess their needs by going over the questionnaire with them and linking them to services and resources in the community that is able to assist them. And there we go. The non-clinical factors by identifying and acting on social determinants of health, improve the health of populations by leading efforts to address social and economical barriers to good health, identify and promote opportunities for change in practice, learning and policy, develop neutral partnerships to make the greatest impact for individuals. Co-create a self-sustaining community where everyone is empowered to live their healthiest lives. So that is what we do within the Institute for Hope. And as you can see here over on the side, we have one of our community health workers who is assisting with fresh food and produce for individuals in the community. Another photo here is a food giveaway. I believe that is during the time of one of the holiday seasons here, where we give out boxes of food. And we also have a program called Food for Medicine, where the provider will write a prescription for a patient to receive fresh produce. Advancing well-being through trauma recovery. So here are a couple photos of my team and myself at various meetings and events throughout the state of Ohio. And again, this is some of the information that I kind of just summed up for you in the beginning, but again, we are hospital-based intervention that serves survivors of all types of trauma and interpersonal violence, including physical assault, sexual assault, domestic violence, and also community violence, homicide, loss, and motor vehicle accidents. So our department specifically focus on individuals that are victims of crime, but also we see all traumas throughout the hospital system. So where you see motor vehicle accidents, that we have seen those that were pretty traumatic for someone who has lost their life in a motor vehicle accident. This will also be motorcycle. So oftentimes, or how a motor vehicle accident could be considered a victim of a crime, if someone causes an accident and hit an individual and they flee the scene. They do not stay to provide any information for law enforcement. So they will then be identified as a victim of a crime. Our mission is to improve and maintain access to resources and services, advocate and evaluate.
Sorry.
It's okay. Voices of survivors and promote engagement and safety. So we provide, we have resources in-house as well. Often, so when an individual come in, and Shanice can attest to this, that they have to, when they're receiving a SANE exam, if there are a sexual assault, they have to take their undergarments as evidence, sometimes for like DNA purposes. So we do have resources within our center, such as undergarments, hygiene products, and things of that nature that we can provide to these patients, and clothing as well, to provide to them so they don't feel totally violated and not having anything to call their own. We operate on a person-centered approach to meet survivors where they are where they are at, and offer autonomy to determine what they may need in the moment. So we do focus and utilize a trauma-informed care model, as you can see in some of our terminology here and how we operate within our center. So one of 8 trauma recovery centers in the state of Ohio, affiliated of the National Alliance of Trauma Recovery Centers. The model is after the University of California, San Francisco General Hospital Trauma Recovery Center. Over 11,000 unique patients served since inception. We receive support through the Federal Victims of Crime Act. That's where that VOCA comes from, awarded by the state of Ohio Attorney General Office. So I talked a little bit about a community health worker, and the community health worker is also different from social work, because what they do is, again, specifically work with individuals in the community who have identified specific resources and services that they may want or need in the community. So a community health worker, CHWs, are members of the community who work in association with healthcare delivery systems as frontline public health workers who are trusted members of or have a close understanding of the community being served. They're certified through the Ohio Board of Nursing. So there is a training program that is about 6 to 8 months that these individuals go through, and they learn how to navigate the community, but also coming into this position, have a sense of the community and resources that are available. They assess for social needs and connect the community to resources, connect to community resources, right? They enroll eligible patients into Pathways Hub, which is a platform in which they can receive a like holistic approach, whether they need a primary care provider, whether they need social services needs, if they need any type of like prescription assistance and things of that nature. And it guides the patient through comprehensive assessment and create care plans to address identified social and health risks. 10 community health workers there are 10 community health workers across the Institute for Hope. Community health worker was added to our team, the trauma recovery team, in spring of 2023, which is fairly new, but she has not had a dull moment, needless to say. More than 12,000 patients outreach encounters, serving nearly 6,000 unique patients in the Institute for Hope. So this is a specific department within this large system that has serviced over 6,600 unique patients. And unique patients is one individual that we have made one encounter with. Next slide. And so some of our outcomes and utilization of the trauma recovery center is healthcare utilization. So we are in the emergency departments, we are inpatient, and some of the patients that are seen in the emergency department, they are admitted, and so we are able to see them at bedside. If a patient is not admitted into the hospital, we do provide follow-up from them, sometimes given from Shanice here, but also from our coach that is specifically in the emergency room. They provide us with a list of patients that was treated and released. So they, again, were not admitted for further evaluation or care. Adherence to post-discharge recommendations. So if we are meeting with a patient at bedside and they are inpatient, we are assessing to see what are some services and needs that they might have or want after being discharged. Because as you can imagine, after sustaining a traumatic injury or going through a traumatic event, it does have a psychological component that can result in post-traumatic stress disorder, which we call PTSD, and also anxiety, going back into an environment in which you received this traumatic event because you have nowhere else to go. Housing is our number one issue here. I would say for working in the trauma recovery department, it is a huge issue and it's one of the resources that we lack at the moment to relocate a patient if they do not feel safe going back into the environment. And so sometimes, unfortunately, they have to return back to that environment. And that's where we can create a safety plan, which is very important for these patients when they have to go back into this environment. So some of those recommendations, and those recommendations can also include in therapy services and counseling. So again, we recently just hired a specific trauma therapist for our department for the patients that we see and serve who identify wanting to further process and discuss the traumatic event that they have experienced. Patients self-efficiency, again, that's empowering the patients to utilize their voice and their choices in which they want and have a voice in their recovery. Slide. All right, so value of trauma recovery and outcomes. So here you see two different photos. The photo at the top is what we participate in is called a resiliency run, which is a fundraiser in which we have yearly for the past 7 years to raise money for our patients that have been identified as a trauma victim. Or survivor, I'm sorry. So we utilize those funds to send the kids from the burn center to camp, provide these patients with additional support that they may need financially, in addition to the services and supports that we receive from the Ohio Attorney General Office. The lower photo you see here, we had some stakeholders and community members and council members of the Cuyahoga County visit at Metro Health, and they took a tour of what it looks like for a victim of a crime to enter into the hospital. So here they are standing in our emergency room in the trauma bay, where a patient will come first to be examined by providers. And then we went throughout the unit. So we also went to our trauma ICU and our trauma floor, step down floor from our trauma ICU. So we have a positive impact on care ratings and patient satisfaction, lower odds of mental illness development post-injury, recidivism, reduction through mental health supports. And this here is why The Trauma Recovery Center has been within Metro for the past 10 years now and provided services to the patients that we see and serve. And I believe that is I believe that's my last slide.
Okay.
So thank you for your attentiveness and
Answer some questions.
being here. So we have some questions. Okay.
You read those.
Yes,
Okay.
I just would like to know which countries are being.
Read it out so that everybody.
Oh, okay. I would like to know which countries are being presented by participants in this training.
Okay, that's not. Okay, that's not appropriate for this.
Okay. So you're gonna go to the next question.
The one at the top was, how do you deal with transference and countertransference during therapy sessions?
Oh, good, Tracy, I'll let you read.
Okay, so that's a good question. So, we're oftentimes told to leave it at work, but honestly, when you are we're dealing with real individuals with real traumas. And so what we do is we talk a lot and, we are encouraged a lot about self-care. And so, not to take that on as a secondary trauma as our own in our department. We do have debriefings, and we also have what we call huddle every morning, where we discuss and talk about the heavy cases that we have. So we do not do individual therapy with the patients, but while we're meeting with them at bedside, oftentimes they are discussing the anxiety, the post-traumatic stress disorder, can't sleep, and seeing the flashing of the car coming right before them, or the incident or the environment that they were in before the traumatic event took place. So we discuss that amongst one another, provide within the team, and provide one another with feedback and support to help release that, so that we're not carrying that throughout our day or taking it home with us. I hope that answers your question, but we are really encouraged to participate in that self-care. Do something for yourselves to replenish that energy that you're giving out to others.
Another question.
Okay, here's another question. Are there formal agreements with institutions providing shelter, and is there a set time frame for placement in these shelters? How is the regulation and monitoring of the shelters conducted?
So we have what we call a Unitas portal, which is a referral portal that we use. And so if a page, for example, if I'm meeting with Ms. Smith, and Ms. Smith says that, I'm trying to get out of this domestic violence situation. I don't want to go back to this house where this man is that is abusing me. And she come in because she has like a skull fracture or something very, very traumatic happened to her. So what I would do is I will find Ms. Smith a domestic violence shelter. Due to the nature of that event, I will have to make that call. So I will call the Journey Center for Healing and Safety here in Ohio and say with Ms. Smith. So again, that's that mutual piece of the trauma-informed part and trauma-informed care model, and also empowering Ms. Smith to speak with the individual, but being there as a support, which is the advocate piece, to support Ms. Smith during that time. So we would make the call together, and then they would assess Ms. Smith, gather information from Ms. Smith. It's kind of, I won't say difficult, but there's multiple layers to it, because if Ms. Smith is not set to be discharged from the hospital for another 2 days, there may be another individual in the community who may need Ms. Smith's bed that will be available at that time. So we make the referral, empower the patient by speaking with the individuals, and making that warm handoff by providing some information on behalf and advocating for the patient. So we utilize that. We do have a agreement between community members and the Trauma Recovery Center where they refer patients to us and we refer patients to them. Tracy, can you read the other part of that question again? I feel like I'm getting off task.
Oh, how do they manage, sorry, I lost it. It just, how do they monitor the shelters conducted?
So there's a separate staff and that's once we make that warm handoff, there are staff members at that agency who monitors, that whole, the shelter piece. But I do know the patients that we refer, they receive case management, they are, eligible for, mental health services, and, they assist them with getting resources for housing.
Okay, there's one more question.
Okay.
How do you collaborate with other service providers or stakeholders to ensure that your clients are holistically assisted?
Very good question. And when we are, so one, with us being a hospital entity, we do have that medical component. So with that being said, if the individual, and we do have that, so where we help to navigate the healthcare setting, because it can be a little intimidating because you're overwhelmed with all these providers you have to follow up with. So we will have patients give us a call, and because we have a trauma department, because we're a level 1 trauma hospital, they kind of get us confused with follow-up appointments. They may just have my card because we had developed this report, made this connection. And so they call and say, you know, I was calling to make a follow-up appointment. Well, it's the wrong department. So advocacy for this patient will look like calling the trauma department and say, hey, I have Ms. Smith here. She needs a follow-up appointment with Dr. Claridge. So we collaborate with different providers within the community because they are aware of our services. They know our services are needed. And so we have these, we would network together and collaborate so that our patients do have this holistic recovery. So for example, even with the Institute for Hope, during the pandemic that was here, if a mom was being discharged from the hospital after having a baby, we will send her home with a box of food so that she would have food for herself and may have other children. So we connect that way. It was another part of that question.
Actually, goes into the next one.
Okay.
There's 2 more really good questions, and this will be the last of them.
Okay.
How do you ensure your safety from patients or individuals associated with the patient? That's one that I think you kind of already covered. The last one is, she wants to know about clients who are affected by serious mental problems like schizophrenia or other problems related to psychosis. Is your organization able to assist them? If yes, can you tell us more and how you help them?
So we do not, if a patient is in active psychosis, then the psychiatric department will deal with them. Once they are stable, then we can assist them because we can't, we don't force patients or individuals to partake in our services. It's really voluntarily. So we provide them with what they may need. And if they're actively in psychosis, we can effectively assess what their needs may be. So we do collaborate with the psychiatric department. Once the patient has been stable and medically cleared, then we will assess and work with the patient to provide them with resources and support.
There's another one, but I don't know how much more.
Okay, one more last question.
Okay, last question. You mentioned you improve health through efforts which address social economic challenges. What economic support do you provide?
We provide bill pay assistance for patients. We also have an opportunity economic center as well that is part of the Institute for Hope, where they have financial coaches that will work with the family to create budgets and provide them with resources for like bill pay assistance as well. We do also assist with, like, if a patient says, you know, I've been out of work for 6 months and, you know, my assistance is running out, we do get them connected with like job services within the community, which we have here. Ohio Means Jobs. We get them connected They may receive a training if that's something that they want to do, and then they assist them with finding employment. So it's really about connecting the patient with the services that they need. But we do provide patients with bill pay assistance and also food services, getting them linked with like food banks and providing them with groceries delivered to their home.
Awesome, Chanel, thank you.
Great.
All right.
Chanel, thank you.
You're
Thank you
welcome.
for sharing this valuable information with our community here in the United States and in Africa. We are so grateful that you took time out of your day to come in and share information about Metro Health's Trauma Center.
We have a
You're
direct
welcome.
thank you to Chanel on here that said they really appreciate it and it was very valuable.
Oh, thank
Okay.
you.
Okay, we're gonna keep moving on because we have a lot of more information today. We're talking about trauma-informed programs and services and the importance of it. So I'm gonna let a few people, we got a few more people joining us. Let them in and we'll continue. So now we're going to introduce you to the services that are provided here at the Renee Jones Empowerment Center. The trauma-informed programs and services that we offer to victims and survivors of human trafficking. So the first thing I want to share with you are the one thing that we do is we provide weekly support groups for those victims and survivors so that they have a constant stream of support. They get a chance to meet other individuals who sometimes most of the time have experienced similar situations. We also have it available. We have other individuals that come to these support groups that sometimes are not victims of human trafficking. They may be having other issues, maybe domestic violence or some other issue where they need support. The value of a support group is it is a opportunity for people to come together. Like Detective Morgan said yesterday, I have always said in the United States, when we have people that are addicted to drugs or addicted to alcohol, there's special groups for those groups for them to stay sober. And I consider human trafficking to be one of those type of groups where we need to make sure that we provide ongoing support for life. Just like any other addiction, even though they're victimized, they need that constant support team. Because being a victim of human trafficking and the things that they have experienced, they really have to have a strong support system so that they don't end up back in that situation. Because here in the United States, and the detective talked about it yesterday, if you were in the training, they can become re-victimized by just simply going on social media because they haven't received services and connect with someone else. It may not be the same person, but there's a lot of individuals out there looking to take advantage of people that have any kind of vulnerability. And trafficking victims, whether they're here in the United States or they're in Africa, the trafficker targets the vulnerability of the person, whether it's poverty, lack of education, low self-esteem, family issues, drug issues, you name it. Any vulnerability, they will use that. So weekly support groups is something that we do on a regular basis every week so that individuals have a way that they can come together, they can come to our center, and they can receive support. So this is some of the groups I'm going to share with you that we provide every week. We have a group called Transformation Support Group. And when people come to the center, they're at different levels. Some people come in and everything is so new to them and they have not had care. Everybody has taken advantage of them. So our number one thing is building hope and trust. When they come into our center, the pictures you're going to see, you'll see lots of bright colors, like everything in here is bright. And you see that big yellow wall, and the artwork that you see on the wall was created by a student in one of our arts institutes here in Cleveland. And anything that we do for victims and survivors, we get their input. We don't just determine, we're going to create this for you. We find out what it is that they need, and then we work to make that need available through programs and services. So when this artwork was created, we had an actual art unveiling, but we had several survivors that worked with the artists who created those pieces to express what they felt. And so when you look at the photos, this is what they're feeling. And at the end, the one where the butterflies are moving around and the girl has her hands stretched out, that was like, that's freedom. So these expressions of art, when they come into this room and they see all of these bright colors, and you're going to hear about our plant club later and see how that ties in. They just come into an area that is an environment that is uplifting, because colors definitely can change your mood. So we make sure that when we moved into this space, we've had this, bold colors when you come in, because if you feel low and sad, when you come in and you see something bright and uplifting, it can change your mood. And so the transformation group is for those survivors who are ready to really take their lives back. And in this group, we're challenging them to go beyond what they're comfortable with, because as a victim, they've pretty much been told what to do, where to go, when to do this. Everything about their life has been controlled, and they have not had the power of choice or decision. So in this group, they learn a lot about using their voice and decision. And I'm very spontaneous. They never know what I'm going to have for this particular group. I just tell them, just be ready and be open for a new experience. Because if all we experience is the same thing, if we live here in the United States and you're there in Africa, and that's all we see, then we think that's all it is. And there's a whole world with a lot of things. Like if you're on this training, there's things that you're learning today that you maybe never even heard about. And we're going to learn the same from you as well. And I'll tell you, this is the beauty of what sharing information does, because this group is just a matter of getting people together in a room and letting them be able to get a comfort level with other survivors. And we participate as well. So we are not there to just hear them talk about how they feel and all of their struggles, but we are participants as well. So in this particular transformation group, we deal with issues and struggles. So you can see a board there with the lady on it. We have two boards, so they can come in and they get a chance to write down whatever they're feeling. But we start off with what we call gratitude. Sometimes in a situation where you've been victimized and traumatized, you may not think there's anything to be grateful for. But when you get people to focus on what they're grateful for, I'm grateful that I'm alive today. So if that's the one thing you can think of, it trains people to start focusing on what are they grateful for. I'm grateful that I have a child. I'm grateful that I have a family member. I'm grateful that this group exists. Whatever it is, we are teaching them to focus on whatever they're grateful for in their life. Then on the other board, whatever they need help with, what are your challenges? And so that's what the transformation group focuses on. So sometimes it will include yoga. Sometimes it will include this particular session I'm showing you here on the table, and you really can't see it that good on this picture. There is a sample wooden casket that we use, because I like to use visuals. Visuals are very impactful when you're trying to help someone change their lives. So that coffin that's on the table, it's a tabletop coffin where they were able to get rid of, write down what it is that was holding them back, whatever struggles they were having. And we basically have a funeral. You throw it in the casket And we basically have a funeral for all the things that you're struggling with. And everybody participates and puts something in there. And so that's an example. And we're all talking, everybody's writing on the board, everybody's participating, and then it's a really powerful thing. And then in the same session, we basically have our survivor, this is a survivor yoga instructor. She will receive certification from an organization here in Cleveland that provided her the opportunity. And she has been here for a long time coming to the center. And they provided, she always had a desire to be a yoga instructor. Well, this organization called the MAT Project gave her the opportunity and gave her a scholarship, because it's quite expensive to go to become a certified yoga instructor here. And they provided that for her. So once a month, she provides in this transformation group a yoga session for all the individuals who attend that session. And then when you look here in this corner here, this over a little bit, you will see that what we try to do is also have where they are talking to each other. So we are learning, teaching them to encourage each other, because sometimes you're not going to have, maybe it's only the people in the group that you get to see. So in this exercise, everybody in the group takes turn encouraging each other and giving them words of wisdom and hope. And it's quite amazing thing that happens, that people get encouraged and feel like they never know that the person in the group with them felt that way about them or shared something great about them. And victims of human trafficking have been torn down so mentally, the way that they've been talked to as a victim, that is very important that we focus on building up their self-esteem, building up their confidence, letting them know that they have worth and value, and learning them how to teach each other the same thing. Learn how to compliment someone else, learn how to encourage someone else in a group. And it's pretty powerful. So that is an example of our transformation weekly support group. And then we have a unique group, which is in a housing, subsidized housing. And what that is here in the United States, if someone doesn't have any income, or they may have a disability, or they may be a young person who that has been homeless and need housing, they apply for this. It's quite the process. But if they're accepted, they get housing in what is called, it's a subsidized housing building. And this particular place that we're at is called Spring Hill Apartments. And there are a couple thousand people that live there. And there are these really tall high-rise buildings. And because they have so many people with so many vulnerabilities like poverty, lack of access, low self-esteem, no parenting in their lives, just all types of issues, then trafficking is can be very rapid in places like that. So in this group, we actually have, we started off with a support group for women, and then the men in the building came forward and wanted a group. So we started a group for the men as well. And then we took this group and took it a step further. This is how you can learn how to make an impact in the community about human trafficking awareness. In this building, there's several thousand people that live in all these buildings on this footprint of this property. So these individuals you see here, we've been having this group there for about 4 years. Now they are we call them the Project Red Core team, and you'll learn about our outreach efforts. But in their building, they are the ones that encourage the residents. They have gained such respect from all the people that live there, because they are the representatives that participate in our group. So when we come there for our outreach efforts, these are the people that they communicate with. And this is how you build community, because we don't live there. And so we're coming there bringing a service, but our service is to teach them how to build their community, how to educate your community about this crime, how to be leaders within your community, even if everything else is going on, that you can still have a positive effect in a negative environment. So that is our group at Spring Hill. And then another group that we have is a morning. So you'll notice they're different times. So we have the one on Saturday, we have the one in Spring Hill, and then we have what we call the Breakfast Club. And the Breakfast Club is, like I said, you want to get innovative, you want to make it interesting. So we have like a light breakfast. So I'm showing you a little example of we have different things each time, but it's a little breakfast. So when they come in, you have a little breakfast, and the Breakfast Club is just another support group. And sometimes we are in the facility in the center having the support groups, and sometimes we get everybody in the van and we go to the lake, or we have a picnic and we take the breakfast to the park. It's those type of things that really don't cost anything, just the cost of the food, but it's the location, it's being in nature, it's being together. And you can see everybody is all smiles because it's really a way of connecting. There's new friendships being built, confidence is being built, and people are getting another experience that's a happy experience. So that's our Breakfast Club. This is another example of the Breakfast Club. We have different topics as well. This particular group, we focused on life being like a puzzle, because their life has been like a puzzle that's been shattered. So we're trying to help them put all the pieces back together. And so this particular group was a Breakfast Club group, but we worked on putting a puzzle together. We poured out all the pieces everywhere, just like how they felt their life was. And then each of us began to put all the pieces together until we put the whole puzzle together. And so it's things like that that are visual, that are impactful, that are simple, but very effective, and building up these victims and building up their self-esteem, building up their confidence, letting them know that they have a voice and seeing that they have a gift. We want to make sure that they know that. So that is another Breakfast Club. This is more of the Breakfast Club. So you can see the variety of activity that happens. So sometimes we'll have speakers that come in and share a particular thing. It could be a life skill. It could be something about going to school. Whatever the topic is, when we are able to, we like to bring in people. We like to bring in survivors who maybe survived. And we have a couple times brought in one person that was an author, so that they could see that even though you've been through this traumatic experience, you can turn your life around and you can do something positive. So bringing in speakers and to encourage them is good. And also the other group is just sitting around talking about different topics. So we will deal with different things that they're dealing with, and create a topic and just let them express how they are feeling. And that's very powerful. Also, we have an art therapist that comes in. Art therapy is very powerful therapy. And we provide art therapy to our victims and survivors who come to the center. And a lot of times it's really a good way to introduce a new person who's coming in for the first time, because it's really not about how great you are at art. It's that the therapist uses different art projects to deal with the different things. So this particular topic, the topic was boundaries, how to establish boundaries. Boundaries are the behavioral expectations and limits that a person maintains in relationships to preserve their mental health and respect the feelings of others. Most victims they haven't had any boundaries because someone has controlled everything about them. So they need to learn as they recover how to establish boundaries. So the therapist that comes in has different art projects that relate to different topics that help them to deal with anxiety, depression, PTSD, expressing themselves, setting boundaries, and a wide range of various topics that they may struggle with. And then they're able to take whatever they create with them. Also, this is another part of our last part of the group. Sometimes you will have someone that you need to give a little bit of special attention to. This particular day, we had one woman that was here for the group, and we wanted her to feel special. You always want everybody to feel that they are important because they are. And we went to the lake and we just had breakfast at the lake. So it's simple things that you can do to empower someone. And the other photo is showing you, like, we'll use a lot of visual things. And this is one of my favorite things that we have. It's a mirror, because I want them to know, do you want to meet the love of your life? Look in that mirror, because it's you. You've got to love yourself first. And so we want them to know, and that is really a powerful tool that we use with it's written right on the mirror. Do you want to meet the love of your life? Look in the mirror. And that's powerful, because a lot of times of some of our victims, a lot of them, especially younger victims, are meeting people online and they're looking for love, what they think is love, but really is someone basically trying to take advantage of their vulnerability of wanting someone to love them. And so we always want to remind them that you are worthy. You're the one. Look at yourself. You're worthy. And then when you love yourself and you learn in these sessions how to love yourself, then you will know to be able to identify when someone is really for real. One of the other therapies that we have is horse therapy. We go take clients to horse therapy at a facility called Fieldstone Farms Therapeutic Riding Center. And they work on providing horse therapy for people with all types of traumas and struggles and disabilities. So we take our clients there for horse therapy. And horse therapy is very powerful for people that struggle with post-traumatic stress. Anxiety is excellent for anxiety and depression. And so providing these various therapies help. And the therapy is not about riding the horse. The therapy is about taking control. You're in control of this big, over 1,000-pound animal, and you're leading them, you're grooming them, and you're building trust with this animal. And it is the most powerful, one of the most powerful therapies that you can help people with. Animals are very powerful to be used for therapy. So we wanted to show you a few pictures of horse therapy. It includes grooming, connecting with the horse, leading the horse, and some sessions they actually paint on the horses. So they have the horses play games with them. So the therapy is very interesting, the activities that they are able to develop at this horse farm for the individual sessions. So horse therapy is very powerful. And also we have, and I talked about this and showed, we have survivor-led yoga class. It's very important if you get a chance to help someone recover from human trafficking and they become a survivor, you want them to fulfill the things that they had desire to do in their lives. And one thing about this young woman, she had a desire to be a yoga instructor, and her coming to the groups, we had someone here that was from the MAT project, which is they are yoga therapy, and they came and were doing therapy for us, and they found out that she was very interested, and they gave her a scholarship to go get the training, and now she is our yoga therapist. I mean, she's our yoga instructor. And so now, she's the one that comes in and does the yoga for the clients that are here. And that in itself is very powerful, because she is an example of what you can do, and that she did not allow her dreams to be dashed. And the necklace that you see was custom made for her, and we gave it to her that day. And that is a repaired heart that was created by our program coordinator's sister, who's a expert jewelry maker, and custom made that heart with a special stone in it. And we presented it to her that day. So whenever you can make someone feel special, whenever you can celebrate what they're doing, that is so much a part of their healing. And they will become a voice and an advocate for those who are suffering from this crime. And that is very important. And some of the other things now, one thing that I believe in is being very adventurous and giving people new experiences. So, because if we just see the same thing all the time, like I said about the experience in different countries, if we only see what we're around, then we are missing out on so much, because there's so much you can learn from other people, from other experiences. So in this particular case, one of the detectives that worked with the detective that you met yesterday, Detective John Morgan, this detective, we call him Detective J, and he works on the task force, the human trafficking task force. Now, I've been working with him for years, and I never knew that he was a beekeeper until one day he came to visit me, and we were working on something, and he gave me a jar of honey. And I thought, wow, why did he give me this honey? I mean, I was grateful for the honey, but I was just interested why he gifted me a jar of honey. Well, that led to our conversation that let me know that he had been a beekeeper for years. So me being the person that I am, I'm like, wow, this is a great new experience. And I'm gonna tell you, was definitely afraid of bees, scared of them. And I thought, but that's part of the empowerment as well, because some things that we're asking people to do, we ain't comfortable ourselves. So that's one thing that I always try to make sure that we're doing, that we make sure that, you know, they can see that we might not be comfortable in it either. But if I'm going to ask you to do it, I'm going to do it as well. So we went on a beekeeping experience, and wow, that was amazing. So we are grateful for that experience. And that was something that was very new, to be able to go in an area and do something like that we had never done before. And these are two survivors that actually took out there was thousands of bees, and they were able to stand there and hold it, and not one of us received a bee sting. Goodness. But you can see they were able to experience something new. They could get an education on beekeeping, learn from the people that were there. They taught us all about bees, the values, and really what we can learn from bees, and the power of teamwork and how these bees work to protect their queen. So there were so many valuable lessons in something like this that was what we call a social outing. So that's an example of social outings that we provide for our clients. We also like to provide an annual retreat. So we go to a place called Pebble Ledge Ranch, where again, I've talked about horse therapy, the value of therapy with horses. Well, this particular farm is a different, unique experience. We take a group of ladies there every year, and their horses are free. They are not in a therapeutic center like where we go for therapy. Their horses run free, and that is a powerful message. They also have wolf dogs, all kind of other animals that are on all of this land. And we go there for a full day. And in the past, we have spent the night there. So it's sort of like giving the clients a vacation where they get a chance to go somewhere. And most of them have never been able to do something like that. And they're able to experience going away, having just a wonderful day. Here we're in a van where they're in different areas or all over this land. They are hanging out with the horses, having a great time, and we're all in nature. So the beauty of that is all of that anxiety, all of the depression. I mean, everything is gone because you get a chance to experience something different. So again, this is something that we provide to all of our clients that come to the center, the annual retreat. And if you've been, they look forward to going. So we are grateful to be able to have funding to do that. And then our last slide is our annual gala, and this is a survivor table. And what we do at our annual gala is provide all of our survivors with ballroom dance lessons. We want them to feel so beautiful coming out of something so ugly as trafficking. So we have an organization that donates our evening wear. This is one of our annual fundraising events where we raise money for the center. And so everybody's dressed up. And so this organization provides clothing for the attendees to come to, all of our survivors to come to the gala. We also have people that will sometimes provide getting their hair done in a special way or makeup. But this organization is called the National Council of Jewish Women of Cleveland. They provide every year all of the gorgeous outfits that you see the survivors here have on, which includes all their clothing, shoes, and jewelry. And so we're grateful for having people to support what you do to make these experiences possible for the survivors. So, and now we're gonna introduce you to Tracy, who is she is our program coordinator here at the center. And she does a lot of other things, a million other things, but one of the things that she does that's a pretty amazing, if you've seen the pictures that I was showing you, you've seen a lot of plants. Well, she's the one that's responsible for the, I'll let her tell you how many we have in here, but let me introduce to you Tracy Grasso, our program coordinator. Welcome, Tracy.
Thank you. Hello, everyone. My name's Tracy, as Renee said. So I've been with the center for 10 years. I do a lot of different jobs around here. And the old center space that we had in a different location had no windows, and it was really small, and we had no plants. And when we got this new center, it's very bright, as you can see. I thought we should have plants. And at first it started out as plants that looked very nice in the center, and we had all these windows, and it finally was a good place to have them grow. And the more we now have 40 different types of plants. Some were bought right away, but it didn't start out as anything but just nice looking plants in the center. And as the clients and victims and survivors came in, a lot of them really enjoyed these plants. They liked looking at them. I've always loved plants, always, and plants are everywhere. They're beautiful, and it's just, you can go to the next slide. It's something that we started realizing that the clients were gravitating towards, that they would come in and look at the plants, and I would talk about the growth of them, and I would notice where one was doing well, and I would have to move this plant to where it could thrive. And this picture is of us at a plant shop, a field trip we took to go to this plant store to let our clients not just see all the different types of plants, but to shop for one that they could take home. And actually our plant club started exactly 1 year ago. So it's been happening for a year now. And they were able to not learn just about the plants, but it's a really good way for them to look at their own lives. And what we started looking at was a plant that wasn't doing well. The very first day they got here, even if they knew nothing about plants, I had them plant a brand new one in a new pot that they picked. So now they have something that's their own, that is small and that requires their care. And it was very neat because they kept the plants that they planted themselves, and they really took ownership each time they came to the center once a week. We have plant club every Thursday. They would come and check on their plant and see if anything had happened and if it had grown. And if it wasn't doing well, why? And that led us to a lot of discussions about our own lives, where something is not doing well, how can we make it better? So if we're not growing in our own lives, or we've experienced trauma and things that are ruining or killing us inside or out, we take that and we fix it. We do our best. We take it out of that environment. We give it more water. We take off the dead leaves, the negative things that are making us not thrive, and work with it that way. And what happened that day was that these people were able to create something that was their own, but also it was them caring for it and helping it grow, by watering it and by making sure it had what it needed to thrive. So the plant club started out because of the interest that our clients were showing in the plants that we already had here. You can go to the next slide. So we also talk a lot about, for our topics, the basic, in the most basic way, plants can help us decompress, unwind, and calm down after a stressful day or when we're feeling upset. In the long run, working with plants can also help us foster long-term success, recovery, and positive emotional well-being. And it's great to see them in these pictures, because how it started was one client that we'd had for lots of years, probably 8 years, really was interested in this specific plant we had. And I talked about how it had been dying and that it came back. And then I showed her other plants, and she just was really interested, and she really started opening up about her experience and her trauma. And the more she talked about these plants, the more she started talking about her own recovery and her own experiences and growth. And it was a really neutral and natural way to talk about it. So Renee and I had a conversation, and we thought that plants really brought out a lot in these victims that otherwise weren't really able to receive a lot of care. But it was like a common ground. So what I started doing was bringing in topics of conversation that could be related to plants. So you can go to the next slide. So growth would be a topic, or roots would be a topic. And what we do is we take plants that are dying, or that are, their roots are actually root bound, where root bound is something that we take the plant out and we see that it's growing too much and that it's getting killed by its own pot. So we take it out and we repot it, and then they watch that one grow. And it's a lot of it is experiment. We are not professional plant, we're not herbalists, we're not naturalists. We just know when to repot, or we look at the environment. In this picture, we did still life with plants. So we used the art therapy and art supplies we had, and they each picked their plant and they painted it, and they whichever plant they identified with. We see a plant that isn't doing well, and we let them decide what do they think it needs. And so they repot it in a bigger pot, or they really are in control of the outcome, whereas they've not had a lot of control in their lives otherwise. And so it's really freeing for them to see each week they come and it's always something different. You can go to the next slide. So multiple studies have proven that plants keep you healthier and happier, offering both psychological and physical health benefits. So honestly, in the last year, from working with our clients in a lot of different ways, the plant club, it has improved mood It reduces depression. If anything, it's a great distraction. You can get a plant anywhere. You could dig. In fact, one of our clients found a pot, dug up basically a plant, outdoor plant in her front yard, and she brought it to us. And we have been growing it, and it's not just grown, it's flowered. And she felt that having something that she could bring to our plant club, and it has actually thrived. So that's something that's been really interesting. And in that moment, you're distracted from regular life. You aren't focusing on all the problems and all the things in your life. It's just a bit of a break for you to really enjoy the beauty of nature. It reduces fatigue, it lowers stress levels and anxiety, improves energy and focus, boosts healing and pain tolerance, higher levels of creativity, better self-esteem, promotes patience and learning. So what's really cool is that we will pot something or we will put roots in, just like this. So we do roots, these little guys here. And the next week that they come, they're looking to see if there's any roots growing. So it gives them something to look forward to. It promotes patience because as much as we want these plants to grow, it takes time. We tell them you can't change overnight. These are things that take time and it takes nurture and it takes care. And with that time, it'll grow. And so we talk about that a lot. So each of these is one individual plant that we've gotten that has roots, and we'll plant these and then they'll grow into their own plant. So that's been really cool to see too. Okay, next slide. So that is what you're seeing right there, the narrative tree of life. That's something we show them at the beginning to really parallel their lives, like where your roots are, where you came from, your history, how the roots grow, what is your support system, what are you able to offer others? What can others give you? The storms, the rain, the thunderstorms, those are all things that are challenges. It's just a good analogy to show. So this is an art that we do. We collect plants and leaves, and we talk about our problems and what we're doing to make those better. And the last thing is that this one tiny little plant that you can see with that flower up next to that sheet is actually a plant that Renee found in her purse. It was a tiny little thing like this. So this thing right here is what it started, this tiny itty bitty thing Renee gave me. And we grew it, I potted it, I put it in water and it started to root. So then I planted it. And all of this is happening with the plant club. And it kept growing out of that one little stem. And now it's this. So that one tiny little stem that Renee decided to not throw in the trash, this is it. That one tiny little thing has grown into this, and it still has that flower. It's just a beautiful message to show that you can grow from anything. And it's a great message that keeps on giving because they keep seeing the progress. So that's why Plant Club has been really great for that.
Thank you, Tracy.
Yeah.
Next, we're gonna have, and I see all your questions. This is our last presenter, then we'll answer as many questions as we can. But I want to introduce to you our nurse, Jaleesa, and she's gonna share with you her services that she provides here at the center. Welcome, Jaleesa.
Hi, I'm Jaleesa. I've been at the Renee Jones Empowerment Center since February. And we offer quite a few things. One of the things we offer are quarterly health talks. And here you'll see some pictures from the health talk that we have quarterly. In our health talks, well, this particular one, we chose to talk about stress management, HIV, fitness education, and self-care. In the top picture, you can see we kind of sitting around just talking. That's a doctor sitting next to Renee that was able to answer all the questions that the group had. We have tried multiple different approaches, but that one was really good. Making it like more so of a conversation and you being able to ask the speaker questions opposed to someone just talking at you. We also, there were also activities to bring awareness to the importance of self-care. And at the end of the group, or any group that we have, we always offer like a general health assessment to anybody that's attending a group, just a blood pressure, weight, temperature, pulse ox, or even information about other things that they might have questions about. These pictures right here are in front of our actual center. We had an outreach program where you see generally more children, and you might get a lot of people with substance abuse and mental health issues. When dealing with these individuals with substance abuse or mental disabilities, you have to treat them the same as you would anyone else to make them feel comfortable and accepted. And sometimes they open up and tell you their story while you're out there, about what they go through or just general questions about health or anything. So my goal is to always make them feel comfortable. We may get people who may just have questions pertaining to their health, and I answer to the best of my ability or give information for local clinics in the area where they will be able to follow up with a doctor, like the free clinic or just like satellite doctor offices we have around. When dealing with this crowd, like consistency is key. If you notice in some of the pictures, you have like some of the same people where you kind of build like a relationship with and kind of look forward to coming every time we open to get their blood pressure checked or talk about things that's going on in their life. This right here is another location that we go out and do, and it's the Lorraine outreach location, where you have like a different group of individuals at this one. At this particular location, we have a lot of like refugees. And sometimes you might come into like where there's like language barriers, where you may have to use like very simple language or hand gestures or even visual methods of communication. We may also have like a lot of people with physical disabilities, as you can see in the picture, and children love to get their blood pressure taken too. And when dealing with the people from all these different walks of life, it's important to just make them feel safe and comfortable and try to build a relationship with them, which sometimes take a lot of time. Some people, since I've been here, won't even make eye contact when they walk past the clinic. And now they come in every day, you know, the time is open, when you're supposed to be there, or when is, you know, anything that we offer is going on. Or sometimes they just come by to talk or have questions or tell you about their doctor's appointment. So it's just really important to just build that relationship with them and make them feel comfortable as possible. So in the clinic, we offer services, blood pressure, like pulse ox, oxygen levels and heart rate, weight and temperature. And included in these pictures, you might see different situations or, you know, different type of people that may have different problems. And we also set our clinic up in different areas, wherever is convenient for the patient. So we have a clinic upstairs, but sometimes we go downstairs into the lobby to make it more inviting. So some people don't want to travel up the stairs, or they just want to make it as easy as possible. So we might set up anywhere we have to accommodate those patients. And we have a lot of educational posters, and what they can do to the possible risks of blood pressure, like diabetes. We might have like stuff that's going over diet or things that can cause high blood pressure or diabetes and things of that nature. We also have health fairs, in which we have one coming up on Saturday, July the 29th. This one is going to be a fit and fun health fair, where we will be located like inside the building, but also outside on the sidewalk in front of the center. And we're gonna have a fun and fit health fair. It's gonna be at the end of this month, where we have fun field day with health and wellness services being provided. We will have health screens, speakers, and engaging booths, displays, and fun and interactive activities and everyone is welcome.
Great, thank you so much,
Thank you.
Elisa. That is awesome. So we thank you
There's about 5 questions.
Okay, so we have about 5 questions that we're gonna answer quickly. Okay, Tracy, you can read the question.
These are specific to transformation support group.
Okay,
Are there specific transformation support groups for specific human trafficking victims, for instance, victims of sexual assault or labor exploitation?
oh yeah, we put it can be we don't separate the groups. What I've found is that we bring everyone together. There's a great benefit in bringing other people together. We don't separate groups based on what their situation is. The groups are for everyone. We even have people in our groups with learning disabilities. The reason why I do that is because if you only see what you've been around, and that's the only behavior you're gonna ever see. So there's great value in bringing all people together. And that's how we handle that.
What strategy do you use to those who are not responding positively to the therapy?
What we basically tell everyone that comes into a center, our charges, we don't charge for anything that we do. Our services are provided by a grant and donors that help us to keep the place open and functioning. So when people come here and we do an intake process, we have everything that you need for your life to get on the right track. The one thing I tell people is that only requirement we have is that you want to. If you don't want to do something, there's not going to be anything that I'm going to be able to do. No program in the world is going to be able to help you if you don't want it. So the number one thing I tell everyone that comes in, how big is your want to? Even if you got a little bit of want to, I can work with that. But we don't really, if you don't want to, then, most of the time people, they don't come unless they want to. Every now and then we'll get a few people that don't follow through. But mostly the people that come in, they like the services. If they're ready for change, you got to be ready for change. If you're ready for change, change can happen. So that is part of all of our groups because I can't make you change if you don't want to change. We deal with all the hurt. We have all the therapies to help you, but it's up to the individual to want it.
How do you address some law enforcers who argue that human trafficking victims are not victims, but criminals and advocates raiding brothels and arresting them? What do you think is the possible perspective influencing them?
I'll tell you, when I started over 21 years ago, I had that same problem here in the United States. They did not believe what I was saying. I was an individual that had a storefront. I had a job, and I would get off my job and open that center. And what happened was the center started as a community center just to deal with issues in the community. And where we were located at the time was filled with crime and drugs and all types of issues in the community. So one of the issues in the community was prostitution. So I thought, okay, good, we're a community center. I'm going to take that on. I'm going to develop a program that, maybe somebody needs to have a program that help people who are prostituting themselves to get a better life. And, they thought I had lost my mind. They didn't believe human trafficking. Human trafficking was not something that they talked about here in the United States. It was something that they thought only happened in other countries when it was alive and well here. And because they didn't know it, it continued to grow and build because people didn't believe it. So it took years. And that came, what the change happened when the more people started coming forward. That's why community education and awareness is powerful, because as I began to do outreach, which is what we did, I've seen it firsthand, the people being sold on the street. So I'm telling them true stories of what's happening. So the way you have to do it is through community awareness. The more you keep making people aware, no matter if it's a little group of people, this family tells this family, however you got to do it, the more knowledge gets out there, then the pressure gets on the law enforcement. Now I'm amazed. I can tell you that I started working with Detective John Morgan way back then, years ago. I've been working with him for years because we were the only little organization talking about human trafficking. And they were bringing people at that time. He was working for the Federal Bureau of Investigations. So they were coming to us But even though we were tiny and small, we kept on communicating. We kept on providing trainings to the community. So I would encourage you to do the same.
Okay, it's 11. There's only one more. How
Okay.
long takes the support group? How many months or years? How many hours per day, or is the group just for a single day per week?
Okay, yeah, and so every day, we have 3 groups a week. We have the Breakfast Club on Wednesdays. We have the Plant Club on Thursdays. We have the Transformation Group on Saturdays. So this happens every week. So they can come in, to the center, all of those, times for training. Course therapies are usually on different days. It might be after the tour, art there. There's always something going on, but those 3 groups happen the same time every week. So if there's other questions, we couldn't answer everything, but we do plan to have these videos available. Not just, we're gonna post them on our YouTube channel, and then at the end, we're gonna tell you how to get them. That way you can get the training that you want. You can see the slides, you can hear the speakers, because we really want it to be valuable to you.
They were wondering how they get all the slides from this presentation.
You'll get it on the video. It'll be included on the
Perfect.
video that's taped. So at the end, we're gonna upload it to our YouTube channel. We're gonna tell, because that's gonna take us some time to upload it. But on the video, you're gonna see this very meeting for every training session each day. That way, if you're only interested in a particular topic, you'll be able to go to that video. So I would say probably a week after this training, we need time to get it all figured out and upload it. Then we will notify you, and then you can go to that. We'll see how we get it done. But we'll make sure that you know, because this way you will be able to see the video and be able to see the slides within the video. And also, I looked at the video from the first training, and it had all of the questions. So you'll be able to see that as well. So we want to make sure you have that. So it's time for us to wrap up, but I want to let you know what's happening tomorrow. Wednesday session will be about human trafficking awareness and prevention programs. And we're gonna have a full program, so hopefully we won't have any flukes. We can get started right away. We are going to have Dr. Mary Weems. She is a very powerful author. She writes plays, and she's gonna talk about using the arts for human trafficking awareness. We're also going to have Carrie Joseph. She's going to talk about prevention and community programs that she does for a center called Journey Center for Safety and Healing. So she'll be there. We're also going to have a teacher, a school teacher, who works for our largest school system here, the Cleveland Municipal School District, and her name is Carla Lovejoy. And she also travels to various countries and does teaching. So she's very interested in sharing that information with you. And then we're going to have a program, a speaker, Donna Angelotti, who represents a program called SOAP, Save Our Adolescents from Prostitution. And what you're going to learn from them is how they use a bar of soap to get the word out about human trafficking. Very interesting. And then you're going to learn about the center, different things that we have that we use for prevention. You'll learn about our outreach efforts, our exhibits, and a game that we have that was created for teens to learn about human trafficking awareness. So thank you for joining us. Well, I hope you have a lovely evening there, because I know it's afternoon, late afternoon there. And we look forward to seeing everyone tomorrow. Thank you.